Everybody. Hope you're all staying healthy.
Hey, Bob, thanks for zooming in with us today. Let's get started with, we've received many questions from members and businesses at large asking about if it's necessary for them to submit a reopening plan to New York State for approval before they can reopen upon getting the green light.
There is no requirement at this time to submit a plan to New York State, but we are strongly suggesting that every business create their own individual plan for reopening, which at a minimum would include the issues of face coverings and face masks, next social distancing, hand hygiene, and disinfecting. We have shared plans from almost every possible enterprise and area of work with the governor's team. And here's the issue. When the time comes to open, whatever that may be, I do not expect the state will inspect a plan before approval, but there will be a process at some point where people will look at that plan. It could be a complaint by an employee or a customer. It could be an area where somebody comes to work or a customer comes in, is infected, infects others, which opens up, I think, an issue of potential liability. Once we get a template, I will share that. The governor's office is working very hard on this right now, and I would say they are gathering so much data from across the state and country. And what we have done, and my role is advisory, to listen and to share information. And a day does not go by where I'm not sharing probably 5, 10, 15 plans from associations, everything you can imagine, with the governor's team to help them and going back and forth. But that's pretty much where we're at right now. I doubt there would be an inspection process before something were to open based on the governor's directives. But I can assure you it would be prudent for every business to work on one now, and many have. I was in a call last week with a very prominent attorney here in Rochester, and she also reinforced this is an area with liability that we don't even know where that will go yet. But to me, it is in a good faith effort. If every business, every establishment, every construction site has certain components in place, and I can assure you what I've read so far, many people are going above and beyond even some of the basics in terms of what they're going to do, which I think is terrific. But that's pretty much all I can say on that one right now. We're giving guidance, and that is the best guidance that I can give right now, but I do think it's very close to what people will find. And again, if a template is put out at some point, we will share that right away. I would defer to the governor to make that announcement or his team. But once it is something we can share, we will. But there's probably no plan that will be absent those 4 components which I just mentioned. I think those are a great foundation to start.
Start with the first question from Jack Watson, then we'll go to Christina Dominguez. Go ahead, Jack.
Hey, Bob. Thanks for taking our questions this afternoon here. Just a quick question about phase 2, because I know that if we meet the requirements, phase 1 would start, and that's construction, manufacturing. A question about phase 2, which seems to be a larger share of the workforce. What would the timetable after phase 1 be like? How long would it be after phase 1 starts that we would get to phase 2?
Great question. What the governor's announced previously, phase 1 will start on May 15th, which is really a week from tomorrow. He said after phase 1 starts, there would be a 2-week pause before the next phase. So that is the information he has given out. Any changes would be up to the governor to make those based on data, but the best information we have, that is what he has stated. I take him at his word. So there would be phase 1, a 2-week pause where things are tested and measured, and then he would make additional decisions. If you saw the chart that he has put out in terms of the data points for our region, we are looking very good in almost every area. The 2 areas where we have a red box or a red mark are tests and also the contact tracing. I'm on a call almost every day with the medical community, both hospital systems, the county executive, the county health director, several others. It is a great call, very informational. Those are being ramped up. The tests what the hospital systems are looking for, we're getting now, are more swabs and more reagents. We'll elevate the test, and both hospital systems are doing a tremendous job with testing. And as they get those extra resources back in their possession, those tests will go up. The state is working right now on the resources with the county health directors on contact tracing. We are getting people contacting us at the chamber asking for how do I apply. Whatever the outcome is, those people will get in place, I would hope fairly quickly. And once they start, that's a tough job. That is a very labor intensive job. And there are discussions about certain technology pieces that may be helpful. But those two areas, I'm confident we're on a very good path. I can't say with any certainty we're going to make those green in the short term, but we're working very hard to do that.
If anyone has a question, please let me know through chat, and I'll call you in the order received. Next up, Christina Dominguez.
Thank you for the opportunity. I have two questions. If I could squeeze them in, that would be great. First, I just kind of wanted to know, do you have to submit some sort of plan or recommendation before the May 15th deadline, before this starts to open? And what does that look like?
Christina, my role has been to gather information and get it right to the governor's team. We have had countless Zoom meetings. I think we've reached probably over 350 people in Zoom meetings throughout all 9 counties. We've done industry leaders, officials, health directors, business owners. We have, I would say, easily 2,000 to 3,000 emails that we've received, and then phone calls I can't even count. So we're listening to people, and there are very strong feelings. There are people that are submitting plans. There's certainly a lot of pain and anger, but also a lot of anger about opening too soon. So we get it all. My job is to get information to the governor's team, and I routinely send plans that I get. I just received 2 in the last hour. I sent one already. When I get off this interview, I'll send another one. I send it to them. I'm not preparing any documents or recommendations. My job is to be advisory. I have a great relationship with the governor and the governor's team. Many of the people working on this as innermost circle are friends and colleagues. I just get them information, but I feel very good about what we have done to elicit information from this region and get that into the hands of the governor. People's recommendations, people's plans, everybody understands the pain. We get that, but we don't hang on to anything. We've shared both pro and con. We've shared plans, and I will defer to the governor to make his decisions. Be it far from me to make a recommendation right at this point, but I get all the information. They've been terrific trying to compile basically the best practices out of all these plans. And as I think when the first phase opens up, I sense there'll be more guidance on or before May 15th coming from the governor and the governor's team in terms of how that will happen. But it's going to be based on just this phenomenal input. And aside from what we are producing, I can't speak. I think Kathy Hochul, I'm not sure what she's doing in Western New York. She's probably doing some of the same things. I don't know. But I know what we're doing. We're overloading their inboxes and emails every day with things. But it's great information. And people here have been terrific with their time and their input. And so my job is to get that to the decision makers, get that into their hands so they can come up with their best decisions. And again, as much frustration as people have, I can assure you, it's all about the metrics with public health. That's what they're looking at right now. We are looking excellent in the Finger Lakes region, except for those 2 areas I mentioned, and we're working very hard to get those back up in the green.
So my second question you sort of touched upon, which is how exactly will this be rolled out next week? What will that look like? Are the companies that are officially going to be able to go into business, I'm assuming most of them already kind of know who they are, but are they going to receive some official word that go ahead and open? How does that look like this week?
I believe that answer is being discussed now in Albany with the governor and his team, how best to roll that out. That has not been released yet. He has identified those 2 areas, construction and manufacturing. To what level, I can't say with certainty. It is everybody in those fields, but I do believe there will be some specific guidelines coming out by the 15th for how that should look. I think the one thing I would caution people, we've seen it in other areas. I think there are some that are taking liberty with what they think they hear and are, well, I think they said this, so I think I can open now. I am definitely saying don't do that. We receive a lot of calls from car dealers and a car dealing association here because in central New York, there was some documentation or letter going out, a news story about car dealerships opening up back to business. That was not the case. They do have an ability to do work now, but there are certain restrictions and guidelines they have to follow. That has not changed. So I would say if anybody has a question, reach out and call. We'll try and get answers as quickly as we can. I actually forwarded a number of questions this week that really are very valid to ask based on what is open now in essential businesses. We're trying to get clarification for it. But I would expect the executive order and guidelines will be forthcoming. And I've learned, I don't want to get in front of the governor. I don't want to even think or anticipate or guess. But I do know that he and that team are working around the clock on this. And there's so much work going on to try and make sure they make the best decisions. But what they do not want to do is open too soon, have the infection rate spike, and then try to close things down, which is extremely problematic. And I always look at the lessons in other states. California with the beaches. Open the beaches, crowds come, no social distancing. The governor tries to close the beaches. Protests erupt, and we get there's anger and pain everywhere. But when a governor opens it up, he wants to make sure it's open with the restrictions and guidelines in place that will prevent a spike. Because as we keep saying, the virus is not leaving. It's here. There's no vaccine. And the more we can do, the better. And maybe just one last proviso. I am recommending, this is just from me, companies that when they do reopen, even essential businesses now, if you can have a large portion of your workforce working remotely, that helps reduce the density. We're doing that at the chamber. If you can accomplish your job with your workforce working remotely, great. Doesn't work for everybody. You can't manufacture remotely. You have to be on a line. So there are restrictions in place for that. Construction, you can't build a house remotely. I get it. But there are other things that can be done. And the more we do that, the more we reduce the density at this time. And really the more success we'll have keeping these rates down and dropping until we finally get a vaccine and get really over this whole pandemic.
Again, if you have a question, please let me know in the chat. We'll go to Tyler at 13 Lamb next.
Hi, Bob. Thank you so much for your time. We were just wondering why exactly are we going this route with having businesses set up their own rules first instead of the government setting up the rules first and then the businesses following? Why go with this approach?
Well, I'm recommending that approach at this point because I'm saying those 4 components in your plan, I can guarantee you they will be in anything that the state releases. The state will release more specific guidelines. And also based on the association plans that are coming to us from the salon and beauty industry, fitness, construction, retail, restaurants, bars, we get them in, and there are plans coming in that are much more restrictive in many ways, but very thoughtful. So we are sharing those with the governor. But what I'm telling people is right now, if I have a store that's not open, I'm going to come up with my plan based on those 4 components and maybe add my own. Maybe I'll reach out if I have a flower store. I'll reach out to my association or other retail organizations, get input. But I'm saying that they should develop their plan now, as opposed to when the time comes to reopen, not having one in place, not having steps in place, having something happen, God forbid, where you're not prepared, somebody is infected, and I think you put your business and self and your employees and customers at risk. So I'm just giving my best guidance to be thinking along those lines before that day comes. And I know the construction and manufacturing industries right now are really diving into much more complex plans. There are people that are recommending one person for a job site whose sole job is temperatures, checking health, and everybody working. I mean, there's a lot of complexities that people are building in, but those 4 foundational principles I mentioned, they will be part of anything. And I did not make those up. That has come from Dr. Mendoza and our health directors, and they have said they will support a business reopening if, at a minimum, they have those 4 components attached to it. And the face coverings are by CDC guidelines and a governor's directive. It's not you have to wear a face mask 24/7, but if you cannot socially distance, you are to wear a face covering. And it does not have to be an N95 mask. It could be a face covering of some sort. Hand sanitizing. When I say hand hygiene, people say, well, hand sanitizer is hard to get. It's expensive. You don't need hand sanitizer. Every doctor will tell you warm water and soap works just great. So I think that we're trying to give common sense guidance going forward. I would think proactively at this point in terms of preparing, as opposed to when that day comes when the governor says that he's the only one who's going to issue these orders. And I want to be clear, I do not give authority for any place to open, nor do I give suggestions that you may. That is not my job. I don't know. My job is to listen, gather as much data as I can, and get that into the hands of the governor's team as soon as I can. And I've done that consistently from the day he has announced this appointment. I have done that every single day along with my team. So that's why I'm offering that. And at some point, I do believe a template will come out. It's not happened yet, but those 4 things will be in that template, I can assure you.
Tyler has one more question.
Yeah, sorry. Hi. I was just wondering, another question I have is kind of a side note. We were wondering if you could confirm, we are hearing reports that Leslie Myers Small is the new Rochester City School District Superintendent. We were wondering if you could confirm that for us, Bob.
No, I can't. I am not in that loop of information, and I'm sure that whatever they announce, the new superintendent, they will. If I knew, I couldn't tell you, but I don't know. I've learned in my career, never confirm rumors you don't know anything about. And I would defer to the school board to make that announcement when they're ready, if that's who it is.
That wraps up we have Andrew Freeman from Spectrum News has a question.
Hi, can you hear me okay? Thank you for taking the question. I was just wondering what message you would have to small businesses that, even especially essential businesses. I suppose you have the issue of, essential businesses, big businesses like Home Depot and that kind of thing. They can reduce their staff, no problem. But these other small businesses that don't have that luxury, they might be, frustrated and feeling the pinch. What is, your message to them?
Well, my message is, if you're not open, hang in there, because this pandemic is like something we've never seen before, and we are asking people to just hang in there. The governor would like to reopen the state as soon as he possibly can. The state is losing money every day. Their budget gap is enormous. Just like businesses are losing revenue, people are not getting, in some cases, may not be getting paid. I would just encourage them to hang in there. If they're open partially right now, if they're doing curbside service, if they're open in some capacity, that is a good thing. I do feel bad for those that are shut down completely, that are doing no business. And I'm asking them, just hang in there. Tomorrow marks it's May 8th. 1 week from tomorrow is phase 1. So we're getting there. We're getting closer. The numbers are looking positive. But the reason the numbers are looking good is because people have adhered to the guidelines. Aside from the frustration, and everybody feels it and senses it, I think people have been great, especially in this region. They have they follow the rules. You can see it when you're out. You go to a grocery store, you see it. They're being very conscientious. And even though they might be frustrated, they're doing the right thing and doing what's necessary, which I applaud. That's why we're there. If they didn't, we would be far worse. We don't want those numbers to spike and put our region at a disadvantage. I mean, the governor has indicated on several occasions, upstate is probably going to open before downstate. There'll be great frustration downstate for the same people that can't open sooner because of the density and in a number of cases. So right now, the Finger Lakes region looks very good, except for those 2 areas, which we are working hard to shore up. I would say hang in there, and at some point, this is going to change. On the other side is I can't predict the economic pain down the road. When the money's run out, and we just had a call with some of our staff, it's very hard to fill jobs right now. There are jobs open, but people may be making more money on unemployment. They don't want to go back to work. So these jobs that right now companies have that are really critical, they're having a very difficult time filling. When the money runs out in July, these extra stipends, I worry about decisions some companies might be forced to make. So, I can't predict the job picture right now. I can't, but we're in for a run with the economy. This is not going to be better August 1st or September 1st. I would say, listening to some economists talk, 18 months at a minimum, we're going to be feeling pain. It will come back. It'll come back slowly, but there's going to be a lot of pain along the way. So I just think the faster we can get back healthy in business, the better. But we do not want to get back and have these infections spike and have another shutdown. That would be, I think, almost too traumatic for anybody. The governor does not want that. We don't want that.
Jack Watson has another question.
Hey, Bob, I just want to draw on phase 2 one more time here. One of the categories in that phase is professional services, and I think a lot of people are wondering when they can get back to the office, what that might look like. Can you shed a little light on exactly how an office reopening could look, and how soon after phase 1 again that could happen?
I'll be certain in the first part of your question. I can't tell you when that would happen, even though in phase 2, I gave my best answer. The governor said phase 1, 2-week pause, then phase 2. But whenever that happens, it depends on the business. If the business given an okay to reopen, I can assure you at that point, they better be prepared for the face coverings when necessary, social distancing, the hygiene, and disinfecting. And I went through basically a call recently with the governor's team and a very prominent grocery store chain. And listening to the steps they go through, it is phenomenal what they do every day and every night for disinfecting and cleansing. So if I were in office getting ready to reopen our business, I would start working on my own plan. I would certainly consult, if I had an in-house counsel or attorney, I would ask their advice as well, their HR directors, using those 4 components I mentioned. But I also would urge people, if you don't have to bring everybody back, don't. If you are functioning at optimal level with your employees or number working remotely, I would continue that. Because the more we reduce the density in the future, it's not going to go away in the summer. In the fall, we're going to have flu season. We'll probably have the coronavirus return. So you have this perfect storm in the fall. A vaccine, aside from some of the headlines, I don't expect a vaccine to come in the short term. You have trials to go through. There may be some highlights, some positive news, but who knows when that's going to come. So even when you are open, I would proceed with extreme caution for your employees and your customers.
That wraps up our questions. Any final thoughts, Bob?
No, we are, I think you have what we know. We're trying to give all the information. Don't read into things. We can't get ahead. We do not know the decisions. And I think that as we get closer to May 15th, we'll know more. I'm assuring you, I'm not hiding or dodging questions. I do not know. But what we are doing, and I can assure you, we are representing this region. People should feel good. What they have given us, the time they've taken, we are sharing immediately. So I feel we are very well represented with the issues, the feedback, some of the questions, the challenges across every spectrum. And we're hoping that that's certainly going to be considered in the decision making. And I have confidence in the governor and the governor's team to make the best decisions at the best time to make those. So we're in May. I hate to say we're rounding third base. I don't want to be that close, but we're getting there. And we're getting there because the people in this region and the healthcare leaders and so many people have worked together, have done a great job following the guidelines and really trying to follow all the things we do to stay healthy. So I would say don't stop that. In the meantime, don't throw those away. Stick with what you're doing right now, and that will get us to where we want to get to faster.
All right. Thank you, Bob. And thanks, everyone, for joining us.
Stay healthy. Thanks, guys.